Changing movement is medicine. If you don't change the way you move, you won't change the way you feel. You might change the way you feel for short amounts of time, but at some time that pain's going to cycle back if you haven't truly changed the way that your operating system is functioning. This is why it's so important to zoom out and look at all the joints. And we look at 3 movements in particular, no matter who you are: a squat, deadlift, and overhead press. Those 3 movements will tell you everything about how somebody feels.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who's out there helping us humans to explore, expand, and explode.
Hey, welcome to The Exploding Human. My name is Bob Nickman. My guest today is Dr. Chad Nowlin, who is a renowned physical therapist and the founder of NRG Physio, a revolutionary approach to physical therapy. His approach really emphasizes accurate diagnoses and holistic treatment. And we're going to be talking about how he goes about that with something called the Keystone Reset, how his goal is to get people back on track in as few visits as possible, and teach them how to use their bodies correctly so that the change is permanent. I really enjoyed talking to Chad. He talked about some basic anatomy and how he works to figure out what is actually going on with someone. And many of these things were not actually taught to him in PT schools. So let's jump in. Here he is. This is Chad Nowlin. I am talking to Chad Nowlin in Indiana. I'm in Los Angeles. He's originally from Texas. I'm originally from Ohio. So we're all over the country with this podcast today. So lots of information coming from different places. We're going to talk physical therapy as the umbrella of what we're going to talk about, and some specifics about what Chad actually does. So tell us what you actually do, because I know you have something called a Keystone Reset. Is that what I was reading?
Yeah.
I don't know what you want to start with, but sure. I've done physical therapy. I had great success, as I was telling you before we started. What's new in the world of physical therapy, and what is Chad Nowlin doing?
Well, in the world of physical therapy, not much is new, probably, but do appreciate you having me on. Always excited to share a little bit about what we're doing. The Keystone Reset is really cool. That was a discovery I made about, 4 years ago, probably, and we can go deep on that. But I think physical therapy sometimes gets a bad reputation. A lot of people go and don't get results. So you've been fortunate in that way. I also think it's important for people to understand that sometimes Band-Aids work really well, but eventually they stop. Our main play is, how do we get to the root cause? I know that gets thrown out there a lot, but it's just been my experience that clinicians, really in every facet of healthcare, are not asking enough questions to get below the surface far enough to really understand, why does somebody have that? An easy example is a disc herniation or a disc bulge. If you've got a listening population of people who are active, or maybe not, but they have pain, then they probably have been told they have one of these, because most people have low back pain. But the question is, maybe, but also maybe not, a disc herniation could be the source of your pain, but where did the herniation come from? And that's the root cause. And if you don't solve that, you're just you easily be in a cycle of recreating disc herniations at other levels. And this goes for any diagnosis that you could find in the body as it relates to a pain condition. It's been my mission over the last 10 years to really understand how the body works, what are the things going on under the hood as a whole person that will lead to these things we see in the anatomy. And the medical marketplace will put a lot of emphasis on the anatomy. Rarely do they get to, why does the anatomy look like that in the first place? And it turns out you can fix the anatomy and achieve results You can just treat pain and get results, but you can also treat the root cause and make pain go away. It's a different pathway, different approach. The results are better because you've solved the real problem, not the lagging indication that you have one.
Let's go with lower back pain because so many people have it, or any back pain, but lower back pain. I've had issues, L4, L5. I've had that. The thing that fixed it for me was a couple of things. One was reading a book called Mind Over Back Pain and Overcoming Back Pain by John Sarnow. One of the things he talked about in his book was that the pain is much worse than what's actually going on, which kind of fascinated me. And many of these pains are caused by stress, which I didn't believe when I read it. I'm folding socks one day, and I'm, how strenuous that can be. And I'm thinking about something incredibly unpleasant, which I didn't remember at all. And all of a sudden, the phrase, my back went out. I just, right in that area, it was like, ow. And I'm icing and I'm on my back with my knees in the air for 2-3 days, all this. And I went, oh my God, I just thought myself into this thing. So now I'm a believer of that factor, because I didn't have any specific injuries that I had, that I could relate to that. So yes. I went, well, what's going on? So that part was huge. And the second part was I had really poor strength. Mm-hmm. Really bad. I didn't have any really. So I started doing Pilates, and I was very afraid to do it because I thought this is going to hurt me, not help me. Well, it had the opposite effect. It helped me. I have not had an incident since then. We're talking now 20 years, maybe. Yeah. I continue core work, and I'm able to reduce stress pretty well. Yeah. So that was sort of a thing where I went, okay, well, what I'm being told is not accurate exactly. My back isn't going out. It's not leaving. It's not being destroyed. It's nothing. It's just, it's muscle stuff. So that's a simple version. But I know there's a lot of people that have chronic back pain. And so when they come to you, how does it go usually? What do you start with?
And I want to acknowledge what you said real quick, because all pain is multifaceted. Because low back pain and chronic low back pain is so prevalent, it gets the spotlight a lot. And so a lot of research has been done around how, psychosocial elements of low back pain are X, Y, and Z. And it's true. Stress is a factor, lifestyle is a factor, other comorbidities are a factor as it relates to low back pain. So low back pain gets a lot of things attributed to it that is less well studied in other areas of pain, but it is true. Shoulder pain, back pain, knee pain. There is a huge mindset component around that. You mentioned fear. Fear is a problem. Fear will remove things from your lifestyle that you love doing. And if you don't, then your lifestyle will force you to remove it so your body can heal. But at the end of the day, things like stress, hormones, your metabolic profile, they're somewhat intangible. But they take a deeper level of work. And we're not trying to minimize the importance of that and that they do have contributing factors to it. But they're definitely less tangible versus understanding like the actual mechanical pieces that feed into back pain. And so they're the easiest to control. They're the easiest to change. And they're the easiest to teach people how to function themselves. It's a difficult process to get somebody over a mental hurdle without some tangible, functional implement to help them do it. And we see that over and over again.
Yeah. And for them to see some results within a certain period of time where they go, okay, now I'm believing that this is what's going on.
Yes. And that is why it's so important to get results quickly. I do think it's important to get results in the correct way, though, because you can get very quick results, sometimes with, oxycodone, or you can get quick results with, an injection, a steroid injection. But even most people know now that those are a Band-Aid. That's not solving anything. That's just covering it up. And people are pretty savvy to that. But, they can get results like that. And like, oh, my pain's gone, so I'm better. And one of the great myths and misconceptions that people need to overcome is that just because it doesn't hurt means it's normal. That is not true. And that is why I made a commitment 10 years ago when I started my practice. Everybody that comes through the door, regardless of where their pain is, we're going to screen every joint: ankles, knees, hips, pelvis, spine, shoulders. If they have some other things going on, we definitely check those. But we have found that always checking those always gives us the best amount of information for what we need to do to help this person. In the case of the low back, in the case of any pain, the pain is not where the real problem is. It's somewhere else. Pain accumulates in the body over time through movement compensation. Stress is getting added to one place because it's not being shared by another. And so the back is just the easiest place for the body to compensate. And this is why so many people have back pain. If you think about it, the knee can compensate for a hip or an ankle. And that is why most knees hurt. The knee is like, there's nothing you can even hurt in the knee without getting run over by a car. It's a super robust joint. But if the hip and the ankle aren't working well, the knee pays the price. Rarely do people's hips and ankles hurt. You always see the joint caught in between seems to be the painful one. And in the grand scheme of a functional human movement, the back compensates for the ankle and the knee and the hip and the shoulders. And so that's why we always screen these joints. And what we find is that if you zoom out and look at everything, then you can zoom in on the things that are real problems. They don't hurt. The ankle never hurts. I mean, if somebody has ankle pain, obviously, but most of the time, somebody comes in with low back pain, their ankle doesn't hurt, and their ankle is one of the biggest problems that they have, especially if they're active. They're hiking, they're cycling, they're lifting weights, they're playing pickleball, whatever. The ankle is like a hidden repository of performance, and people don't even know it's a problem because they think it doesn't hurt, and therefore it's fine. And that's why it's so important to check everything, zoom out. How does the movement look? How do the joints look? And then zoom in on the things that are going to change the movement the most. We have a couple of sayings that we live by. One is pain is not a medical problem. It's a movement problem. And if movement is the problem, movement can't be the medicine, because it's a very popular saying: movement is medicine, movement is medicine. In the case of restoring a pain condition, an orthopedic condition, movement is medicine is too broad, because we see people get hurt when they move. We can also see movement be very restorative. So there's got to be something more than that. And that's where understanding how movement feeds into pain. Changing movement is medicine. If you don't change the way you move, you won't change the way you feel. You might change the way you feel for short amounts of time, but at some time that pain's going to cycle back if you haven't truly changed the way that your operating system is functioning. This is why it's so important to zoom out and look at all the joints. And we look at 3 movements in particular, no matter who you are: squat, deadlift, and overhead press. Those 3 movements will tell you everything about how somebody feels. And they also tell you everything about how somebody's going to compensate when they move. And then we can correlate that easily to their movement screen. Like, hey, we already identified your ankles are stiff and asymmetric, your hips and stiff and asymmetric, your shoulders are stiff and asymmetric. So then when we go over here and watch the squat, the deadlift, the overhead press, we can then just kind of clue them into, hey, notice how when you overhead press, your elbow flares out here, and how when you squat, your knees cave in, and how when you go to bend and pick that thing up, your back is really round because you can't get there in a good position. And that's because you had 1, 2, 3, and 4 on your joint screen. And it's an easy correlation once people see it and understand kind of how those things play together. But that's been just some of our easy ways to kind of help people start wrapping their minds around how does the body work as a unit, rather than, the specialist, the hyper specializing on low back pain. You can treat the low back for low back pain and you can get results. But if you don't solve why the low back has that problem in the first place, then it's easy to get on the hamster wheel. And we see a lot of people on the hamster wheel. probably 95% of our clientele in the last 5 or 6 years have already tried therapy, chiropractics, meds, injections, and quite a few of them had already had surgery and still have the same pain they went in with. So yeah, we're not saying this is the way it is and everything else doesn't work or you shouldn't do. Just from a place of these are the types of people we've been working with, and these are the things that have worked really, really well over and over and over and over again. For the people who have already done all those other things, I'm only going to speak about the things I've actually done and seen and use myself. I would never speak to something that I haven't done. Doesn't seem like I should do that. You know what I mean?
Well, yeah. I mean, you get more credibility, obviously.
Sure. Yeah.
So the idea of changing movement, that seems very daunting in terms of the habits that people have and for decades of habits. How do you retrain the body or get people to retrain themselves to use their body in a different way? Because, you always hear like stand up straight, your posture is not very good. Well, that doesn't work. I mean, you're unconscious most of the time when you're walking around. You're not thinking about your posture. Talk about that for a second, because I'm always fascinated about how do I change my body.
It's easier than you think.
Yay.
There's a really powerful thing that happens. And I think before we launch into this, it's important for people to get maybe a new definition of what pain is, because they probably don't know. When you ask people, what is pain? Well, let me ask you, what is pain?
It's a great question. I mean, to me, it's an inflammation in an area of the body that is probably not getting a certain amount of blood flow. That's how I think of it. It's like throbbing because it's seeking something that it doesn't have. Yeah. As a layman, that's how I would describe it.
Yeah, and that's probably a little more advanced way to describe it, but it's on the same track as what most people will say. When you ask them what pain is, they're going to describe to you how pain feels.
Yeah.
You went a little further to attach, like there's something going on under the surface that makes it feel that way. And that is true, but most people can't get past the sensation of pain to understand what it really is. All pain is a feedback loop. All pain is asking you to do is make some changes.
Pay attention.
Yeah. Like, hey, you're not doing something you should be doing, or you're doing something you shouldn't be doing. And it's not specific. It's not even specific to what hurts. Just because your shoulder hurts doesn't mean you need to make changes in your shoulder. We'll wrap around to that with the Keystone Reset. So I think first understanding that pain is a feedback loop, and it's a very, very powerful feedback loop, is important to understand, because when somebody has pain and when you change movement in the way it should be changed, the pain goes away right then. It's immediate. Maybe it doesn't go all the way away, but it's significant and people notice. And when we're looking at like have you ever read Atomic Habits?
No.
Okay. So it's pretty basic stuff. There's cue, craving, response, reward. Okay. And if you want to build a habit, you create a cue that prompts you to do the thing. It's, you walk by a package of ding dongs. The package of ding dongs was the cue. The craving was, how that's going to taste if you eat it. Your response is that you unwrap it and consume it. And the reward is how good it tastes when you eat it. And that's the habit of eating ding dongs if they're just sitting on the counter. So there's a way that you build a habit through cue, craving, response, reward. There's a way that you break a habit by cue, craving, response, reward. And so if we put that in the context of pain, you can attach a very strong reward to, I moved like this and it hurt, and I moved like this and it doesn't. And now people have a direct connection to when they feel the pain, they know they can do this instead and not feel the pain. And it's not hard. You can take somebody in whatever state they're in. If all their joints are stiff and asymmetric and not working well, there is a version of a squat that they can do with no pain. There is a version of bending over to pick something up with no pain. And there's a version of lifting something overhead with no pain. And this goes for back pain, shoulder pain, knee pain, foot pain, it's across the board. And so in that way, it makes it very easy for someone to change movement, because now the pain becomes their cue to change it. Rather than continuing to move and just feel the pain and not know what to do about it, now they have this direct stimulus with the direct reward. Oh, I moved and that hurt, but I know if I move and it hurts, then I need to make this adjustment. And then I do that and it doesn't. You do that enough times, you have a new habit. Mm-hmm. You have a new motor pathway, a new pattern in your brain that has been built on not having pain. And so we see people make these changes just like that. And they come back and they're moving so much better because they've had a week's worth of practice of, I was doing some stuff on my own and I noticed it hurt a little bit. So I just made this little change like you showed me and it was better. And they come in and they just do it. I'm like, hey, show me your squat better. Always room for improvement, always room to optimize and refine. But pain is a powerful, powerful tool to tell you what should you do, what should you not do. And this is where it gets kind of tricky. You had a great experience with physical therapy, which I wish was the case for everybody, just viewing my profession as a whole, but unfortunately it's not. And there's a lot of reasons for that have nothing to do with the therapist themselves. Like any profession, there's, it's on a bell curve. There are some that just suck. We don't know how they passed their boards and got a license, but here they are. Most are at the top of the bell curve. And then there are some who are really leading out front and they are excellent at their craft. But there are still a lot of things going on with insurance that drive high volume centers. It's restrictive. You can't just treat everything that needs to be treated. You have to treat associated with the diagnosis. So there are a lot of things that kind of trap even great clinicians in a box. And what happens is you get a home program and they send you home with it. And it takes 30 or 40 minutes and you don't really have a lot of change from it. And that's how much of how often do you think people are going to do that? You know what I mean? Because you talked about maintenance care, like continuing to do the things. You don't continue to do the things if they don't work. And then you go back and see them. You're like, hey, I still have my pain. Well, you've been doing your exercises? Like, no, but they didn't make me feel better. So I quit doing them. And then they say something like, well, if you just keep doing them, eventually your pain will get better. And if you don't really understand how the body works, that could potentially make sense. But the truth is, if you have pain and you do the right things, you get rewarded near immediately. Like there is always a dose and a response to the right things that let you know that was right. There's also the negative side of that where it's like, I did this thing and it made me worse in the moment, not too long after, or I woke up the next day and had some real problems going on. You should not do those things. There is a line of if it hurts, don't do it. You have to have some discernment of like, what is the right level of hurt versus not. And sometimes it takes a therapist and a coach to help you understand what that is. But the worst one is just keep doing it and eventually it will work. That's a waste of time. Why would you do things waiting for them to work when you could just find the things that work and beat those things to death? Just do the things that work over and over and over and over. Your body will pay you dividends for doing that. And then those can easily become the maintenance. Now, we do not like to have rehab and then self-care. They should be the same. If you have a rehab program and some other program that's supposed to take care of your body, you have to pick and choose, and then one suffers, or you just don't do either, because that's human nature. If you have too many things to do, you don't do anything. And so we have found it incredibly important to have very short, to-the-point programs that create results inside the time you do it, and have them done in a way that seamlessly integrates into life. So self-care is rehab, and the same things that rehab are the same things that prevent and maintain, and the same things that should help you perform to a higher degree in whatever you're doing. And if there's a difference between those two things, you got to close the gap, or you're going to start to lose people. People are going to have to start picking and choosing, or they're just going to stop engaging with what they should be doing, because it can be very overwhelming to have too much to do or not know how to seamlessly integrate things into lifestyle. People are busy, and we know that. So we try to feed on the fact that we know people have too many things to do already. So how can we give them the things that we already know are going to be right, that don't take that long, and they're evergreen? Like they should just never go away. They rehab, they maintain, they prevent, they add performance.
So when somebody comes in, you do a evaluation from head to toe. Obviously, you're looking at every single. So that must take a few minutes, huh? Like
Literally just a few minutes.
yeah, but you're touching and moving and trying different part. All the joints and all that stuff. It's you can. I guess it's an interesting thing when you go to somebody that you can tell they know what they're doing, because the way that they handle the different body parts as they're doing an evaluation, you just go, they're getting information that I have no idea what it is. I'm not going to find out till they're done, but they're going to tell me something. And because I've had this happen, we're like, well, the pain you're having in your hip is not from your hip. It's from I've had that. So I know exactly what you're talking about. Try doing this. I've had these experiences, and it's great to get that kind of information. And I don't think you can get that without studying this stuff. I mean, it's really a knowledge of anatomy plus experience.
Yeah. And I came out of the corporate world seeing 4 or 5 patients an hour as a function of insurance. Ultimately, that's what pushed me out. I had a lot of like cognitive dissonance between what I thought I could do for somebody and the constraints of what I was actually able to do in the moment. There was just not enough time. But what I was doing was essentially 15 minutes of manual therapy with a patient, and then going to the next and the next and the next. I literally did manual therapy for 9 hours straight every day. And so I got a tremendous amount of reps in. I mean, you couldn't quantify them, the amount of reps I got on every joint, like every big joint. I'm not talking about like fingers and some of these little ancillary joints. I'm talking about the prime movers, the hips, the knees, the ankles, the shoulders, the elbows. Spine is packed in there. So I got a tremendous amount of like data around what does a normal joint look like and what does an abnormal joint look like. You got your textbook things that say, yeah, it should do this and it should do that. But like if I had somebody on the table who had knee pain, I worked on both joints because I wanted to know what's the one that doesn't hurt move like, and how can I compare the one that does hurt to that. And I got a real good sense really quickly for what should a normal joint actually move like and feel like in its own internal mechanics. This is separate from how does that look inside a functional movement. But then I could start to correlate really quickly. Okay, well, when a joint is missing this piece, this is what it looks like when they squat. Like if the ankle has 0 degrees of dorsiflexion, the knee is probably stuck in external rotation. And to bend the knee into a squat requires internal rotation. So it just creates a very specific look over and over and over again for what the squat looks like. And so I could start with the joints and know what their movement's going to look like, or I could start with their movement and already know what their joints are going to look like. And that is just from time and practice, lots and lots and lots of reps. But the interesting thing that happened is when I started my own practice and committed to checking every joint, I actually would start at the feet and work my way up very, very quickly. So I just niched down on CrossFit because it was easy to find gyms and go speak and get clients. We've branched out a lot since then. I was working with very high level movers. They're doing very complex movements that require a lot out of their body. And I noticed really quickly that regardless of pain point, pretty much everybody in America has the same restrictions in their ankles and their hips and their shoulders, to varying degrees for sure, but almost nobody had normal ankles, normal hips, or normal shoulders. So started just really seeing the patterns of like how most humans have the same lifestyle. They work 8-9 hours a day and they sit at a desk, they commute, they binge Netflix, they sit when they eat. They essentially spend 23 hours a day in fetal position. And then if they attempt 60 minutes of exercise in not fetal position and wonder why their body hurts. So we just started noticing all these same patterns of restriction. The most interesting thing to me this was 6 or 7 years ago, I didn't even know what to do with it at the time, was that 100% of people with pain anywhere had an asymmetric pelvis. So this could also be called hips out of alignment, sacroiliac joint dysfunction, leg length discrepancy, functional leg length discrepancy. A lot of names to describe the same thing, asymmetry in the pelvis. And this is how the Keystone Reset was born. The human frame, it's an architecture in its own right. And do you know what a keystone is in architecture?
I don't.
Okay, so keep your eye out driving down the road, looking at houses. If you see a brick archway, there is a triangular shaped or like a trapezoid shape at the very top center. And that shape is what allows the lower arch to wedge into that and create stability. It's an archway. Which by its nature is a self-supporting structure, but then it also supports all the weight of the house that's stacked on top of that because you've got bricks or whatever else that's on top. In the human body, you see the same structure. The feet come up and arch straight into the pelvis, which is wedged into this thing called the sacrum, which is a triangle. And this is what creates tremendous structure for two halves of the body merging into a midline.
Mm-hmm.
If you imagine, it would be a very unstable structure if the sacrum was a rectangle, and you would just have a ton of shear force right there in the pelvis. That's why it's called the keystone. And what we found is that if somebody has, let's just say their shoulder is 50% of normal. This actually happened. I stumbled upon this as an accident. Somebody came in and was explicit. I have low back pain and I have shoulder pain. I would typically only associate the pelvis asymmetry because I always check that for back pain. So I would restore that for the low back. And so just on a whim, they had back pain. So I corrected that first. And then I went straight up to their shoulder to start working on some of their shoulder restriction. And the shoulder was normal, which I was like, man, that's really interesting. And I'm talking about big restriction, like missing 40 or 50 degrees of flexion. Their front rack position was like in here, stuck like -10. It should be +30. And I did this right down to the table, like buttery smooth. This one went to normal. And so, in the moment, I was like, wow, that's really weird. And so I committed, okay, the next 10 people that come through, I'm going to do the same thing. Regardless of if their back hurts or not, if the pelvis is asymmetric, I'm going to correct it and then check their shoulders. And all 10 of them, the shoulder changed every time. Then I expanded that out and I started looking at, okay, I'm going to screen all the joints. I'm going to check the pelvis. If it's asymmetric, I'm going to correct it. And then I'm going to go back through all the joints. Turns out ankles that looked like one was really stiff and the other was less stiff, they would flip-flop. It'd be totally different. Yeah. The hips, it would look like external rotation on the left was 70 degrees and the right was 30, and they'd flip flop. Or they'd go symmetrical and be more normal. They'd add motion. And it just became a way for us to better understand what's actually going on in somebody's body. The motion doesn't always improve, but it does reveal the true nature of the restriction and the asymmetry, which allows us to build a blueprint for what do we need to work on to a much greater degree of specificity. There were a lot of times looking back where I mobilized a shoulder that probably didn't need it. And I had people working on their hip with a home program. They should have been working on the other one. So, you know what I mean? But as soon as we started implementing this, we took our time to pain resolution to like 1 to 2 visits. And remember, these are with people who have had a chronic thing. They've already done all the things and they hadn't gotten the result they're looking for. And we get them pain relief in the first visit, which is the evaluation. We're not even doing anything hardly. Or the second visit when we start adding in some hip programs. And it's kind of old hat now because I've done it a trillion times, but man, it was interesting. Still interesting. Eventually I had to go figure out why it works like that. And so we went back to the anatomy and the biomechanics and really started studying fascial planes and all of these things. Helped us make sense out of what we were seeing. It was a total game changer. But I mean, literally to check the joint, therapists will get out their goniometers and measure it. They have to do that so they can show improvement to get paid. But the truth is, it's do you have enough? Yes or no? And if it's a no, It doesn't matter. You have to make it a yes. Otherwise, if it's not enough, if it's asymmetric or it's stiff, somewhere else in your body is going to pay the price for that. And so you just have to turn the no's into yeses. And it takes 15 seconds to check the ankle, and it takes 15 seconds to check the hips, and it takes 20 seconds to check the shoulders. It doesn't take much time. We can do the whole evaluation in 3 minutes. We can add another 5 minutes in and watch them squat, bend over to pick something up, and lift something over their head. And in 10 minutes, we've got a tremendous amount of information of what does this person really need to be doing. We'll spend 10 minutes doing some coaching, show them how to change their movement right now. And they're like, oh my gosh, that feels good. You know what I mean? And then we just say, hey, look, like when you come back, these are the things we need to work on so we can make this pain relief permanent and get you to the target movement. Like, yeah, your squat looks like this, and we can make it pain-free right here, but we need to make it pain-free over here. And the rest of our process is closing the gap between the two until people understand, how do I take care of myself? How do I know what good movement looks and feels like? And when it's not looking and feeling like it should, what tool do I pull out of my toolbox to change that in just a couple of minutes? And we're really just trying to set people up, not with rehab, but with a strategy to take care of themselves for the rest of their life so they can get stronger, not have setbacks, add years to their life and life to their years versus just a downhill slide to whatever their end age is.
So the things that cause misalignment and things in joints, what are those things? Some of it's sports, probably. Some of it is, you mentioned fascia.
Fascia,
yeah.
Yeah.
You mentioned that, and I'm sure there's the health reasons of, dehydration, improper diet, lack of exercise, those kinds of things. So is that part of what you're doing too?
Those conversations do enter. We almost always have the conversation around fitness. The way our programs actually work, we microdose fitness into the deal. So if people aren't working out, we're creating a pathway to get started. Mm-hmm. They're called loosen, lengthen, load protocols. Interesting dynamic is that if you don't use it, you lose it. That's what got you in this place in the first place, right? You stopped taking your joints to end range, and they eventually got stiff and unable to do that. So if you restore it, you still have to use it on purpose. You have to retrain that as being important and valuable to your body, or your body will just discard it. Like, you can mobilize and stretch all day long. If you don't use it, you lose it. And so it's so important because you can't move your way out of a joint restriction, and you can't mobilize your way to a new movement pattern. You have to change the joints, change the muscles around it, and coach that intentionally back into your movement and use it frequently and consistently and intentionally if you're going to keep it. Now, once you have it, as long as you keep using it, you don't lose it. So that's the maintenance piece. But what we have found is that just take the body as a series of repeating pattern of really mobile joint, really stable joint, really mobile joint, really stable joint. So you can see the ankle, really mobile, tons of degrees of freedom, followed by the knee joint, which is really stable. It really only does up and down. It has a little rotation in there that's important, but it is a very, very stable joint, and it doesn't have a lot of freedom to move. Then you go up to the hip, incredibly dynamic joint, right? It's a ball and socket, tons of degrees of freedom to move. And then you go into the lumbo-pelvic complex, which should be really stable. But then you have the shoulder, incredible degrees of freedom, followed by the elbow, very stable joint, wrist, tons of degrees of freedom. So what we see is that the stable joints remain stable because they don't require anything to stay stable. The mobile joints start to become stable because they require a lot to stay mobile. And then what we see happen is that as the mobile joints, the joints that should have a lot of motion, start losing mobility, they start forcing instability in the stable joints. And this is why the knee can become unstable. This is why we see the pelvis unstable. It's probably the first thing that's going to destabilize in the body, and it is the downstream effect of a stiff and asymmetric hip and ankle. So we start with the pelvis because it changes a lot of the dynamic of how the body is moving and feeling. But we quickly go to hips and ankles because those are the root cause of the pelvis asymmetry in the first place. We always want to trace this back to lifestyle, which you can just take sitting as a lifestyle, and you got that. But there are also these little quirks that people have. They sit just a certain way in their car. And they drive 3 hours a day. Yeah. They get on the couch and they kind of lounge in this same position all the time with one hip kind of tucked up underneath them. And so this is where we start to see these big asymmetries come in just from these little lifestyle things that people have over a very, very long period of time. Look at somebody sit on the couch. They've probably been sitting on the couch like that since they were 20, whatever. And this is where we see the asymmetries start coming in. And but that's the root. I mean, we're always looking back to, why are the stiffnesses there? Why are the asymmetries there? And then we're seeing just the repeating pattern of, the things that should move a lot are now not moving hardly at all, and it's forcing things that shouldn't be moving to start moving a little bit as a compensation around that.
I'm fascinated with the ankles because there's so much weight above them all the time, and they're kind of remarkable in that way that they can handle, the entire weight of the human body is on your ankles and feet. And so
that's a massive conversation.
Yeah. So as somebody who does yoga, and my balance is probably one of my weakest areas, one-legged balance. And I've been told by somebody, whether they were right or not, that it was ankle strength that was causing that a lack of ankle strength.
Yeah.
So I don't know how that sort of developed over the years, a lack of ankle strength. So, but I try to like turn my foot in both directions, clockwise, counterclockwise, and it's really an interesting thing to have these points when you're rotating your foot that stick. They kind of stick a little bit. You can feel it. And you get this, and I get this feeling like it's like a frustration through my whole body when I can't do it. I'm like, fuck, God damn it. I want to be able to do that. So you're laughing because you know what I'm talking about. Yeah, so I do both feet and I try to rotate them in both directions. Sometimes on my back with my knees bent, I'll try it, or sometimes I'll do it standing up or laying down with my feet out, and my balance has gotten a lot better, but it's still like, and I'm thinking, well, is there something I can do in terms of physical therapy or chiropractic adjustment or something to give me more mobility in my ankles and better balance? Because I don't want to be one of these old guys that falls down because my balance is crap, I mean, it's not that bad, but it's, I'm exaggerating.
Yeah. Now, I will say this. Strength is a fitness problem. You can take this with a grain of salt or the whole bottle, whatever.
Okay.
A lot of people equate strength to things that it doesn't need to be equated to. Like, this is my favorite. You have pain here because this muscle is weak.
Yes, I've heard that.
Yeah. Weakness and pain do not belong in the same conversation ever.
Oh, okay.
Okay. And here's why. I've worked with 98-year-olds, severely deconditioned, weaker than skim milk, but they have no pain. Their lifestyle just requires nothing of them, and so they feel fine. I've worked with bodybuilders who could lift a truck with incredible amounts of pain. The two things just don't go together. And if pain was solved by more strength, then people who go to the gym would not have pain. There's just too many links that are broken in that conversation for it to make sense. More times than not, if a muscle appears weak, it is inhibited. It is lacking function because it's attached on or around a joint that does not have the appropriate amounts of mobility. And we see automatic. You test somebody's hip and it's like no strength whatsoever. And then we dig around in their QLs, this muscle here in the side, and then it's normal. It's just the muscle is not functioning well. It doesn't mean the muscle is weak. But if you can change how strong somebody is in 15 seconds, it wasn't an actual strength problem. It was just the body is having trouble firing that muscle. It's a different problem to solve. You solve it in a much different way. To convert this over to balance, where we really see strength come into play with balance is not in like a single leg balancing environment. It's when you hang your toe up on something and you have to take that quick step and catch yourself. If you don't have enough physical strength to decelerate your body weight and stay upright, that's where strength becomes a problem for balance. You're going down. This is where deconditioning in the elderly is really a problem, because they lack so much physical strength that if they stumble, they cannot catch themselves. And that's why strength is important for balance. When it comes to balancing in its truest sense, single leg, unstable surface, there's only three things that are at play there. Your joints, which have receptors in them telling your body what position is the joint in. So it creates an internal reference point. Muscle spindles are also kind of wrapped into the deal. You have your vision keeping you at zero on the horizon, and then you have the inner ear, which is always at work. This is why vertigo creates such real problems, because the inner ear also affects the eye. Vertigo is nasty, really, really nasty. But if you want to improve your balance, improving your joint mobility at the ankle, immediate upregulation and balance. Doing the same thing at the hip, immediate upregulation and balance. Because if the joint doesn't have the appropriate slack where the joint is in a good resting position, it's called joint centration, then you're always getting faulty feedback around what position your joint is in. And then it's no wonder why you can't stand on one leg. You're not getting the correct feedback from your joints. You're only having reference from vision and inner ear. And then if you just want to layer in, hey, my joints are stiff and my vision's not that great and my inner ear is, severely deconditioned because I haven't been on a merry-go-round since I was 6. Then you got a recipe for falling down a lot, which is not the case for most people, but we do see. Yeah. But yeah, I would bet that if you improved your hip mobility and your ankle joint mobility, single leg stand becomes dramatically easier within 3 or 4 minutes.
Yeah. So how do I do that?
That's a good question. I'll text you some videos.
Okay. Thank you. Yeah. Also, I do have an eye condition, so my vision is not great.
Yeah.
And so, and I was saying that to say, I think it's my vision, and the guy was that's keeping me from getting a better balance.
Yeah.
No, it's ankle strength. You got to get on a ball and an ankle ball, and I'm like, I'll fucking break my ankle if I do that. I'm not going to do that.
Yeah, there's a way to rule out, what it is. The main thing you want to rule out is the inner ear. And the way you do that is that like you got to be in close quarters with other people stacked around you, because if the inner ear is not functioning well, it puts you in a position to fall over very, very easily and very quickly. We've seen this happen where we put somebody on unstable surface. We have them close their eyes and it's like, boop, fall over with great speed. It's not even like, oh, I'm going. It's just like they collapse. This is very interesting. But to test the inner ear, you have to go unstable surface that removes the joints to a degree. You have to close the eyes, and then you have to do certain head movements that get the inner ear working in the way that it functions.
That's interesting. Yeah. I do a lot of yoga with my eyes closed. I don't have a problem at all. I don't know if that makes it, it's not like, it doesn't scare me at all. I really like it because I can feel my body in a way that vision takes away from that a little bit.
Yeah. And that's probably a good indication that your inner ear is probably functioning fine.
Yeah.
To get pretzeled up with your eyes closed and maybe you're on all fours or not, maybe you're on a 3-point or even a 2-point. And so, but yeah, there are dedicated tests for ruling that out.
Okay. So there's just a tremendous amount of great knowledge that, you can use to pinpoint exactly what's going on. I love this. So if people want to, do you have an online presence where you can do things, or is it all clinical?
No, we have online coaching.
Oh, okay.
Yep. We've got all of our Keystone Reset self-evaluations that walk you through how do you test all your joints? How do you do your own version of the Keystone Reset? How do you retest to see what the changes are? So you can build a blueprint with our L3 protocols. How do you zoom out and then figure out what to zoom in on? And then how do you change those things? So a little bit of mindset mastery, mobility mastery, and movement mastery. So what should your movement look and feel like? And how do you achieve that? So we've got online programs for that.
What a great thing to be able to learn about your body and not have to, travel to Indiana if you don't want to.
Yeah. Our goal has always been the same, which is not make people reliant on me or NRG Physio, but to teach them how to take care of themselves. We always do that. Every time people come in, we do manual work because it can accelerate the process. I don't work with people more than 6 or 8 visits. By visit 2, they feel good, and the rest is just teaching them what they need to know to be successful forever. But there's always lazy people. You know what I mean?
Yeah, I do.
Right now, I'm working on putting this in a book. It'll probably be called Pain Freedom: How to Get Pain Free and Stay That Way. Got a couple of working titles going on, but it's essentially part 1 of the book is all of my stories in healthcare, where there was just tremendous amounts of hurdles to overcome because I had to solve a lot of my own problems. And then I just got, the great fortune to be able to transfer some of this over to a lot of people over the last decade. Tens of thousands of patient visits where I've gotten to learn more things that I didn't know when I solved my own problems. Now we can solve problems faster with some of the things that I've learned over the years, which has been great. Part 2 of the book is our concepts and illustrations that help people understand how functional capacity, which is, the combination of functional mobility and functional strength, how these 2 things are knit together in pain relief and longevity and quality of life, and we've got different ways that we communicate that and show people visually that help them just more easily understand, this is how the body works. This is why these things are important. And this is how you do it in a way that is pretty seamless. And part 3 of the book is devoted to teaching the Keystone Reset, the self-evaluations, all the L3 protocols. What should your movement look and feel like? Not because we think our movement is right and this movement is wrong, but because we have seen this movement be pain-free and these be really painful over and over and over again. We're going to load that out with QRs that will link people straight to the videos that will teach them how to do it. So they'll get the full sweep. For $30, they can get a decade's worth of my info and the things that people pay me $2,000 or $3,000 for to help them with. You people be able to get it for $30. But I also know people are going to not finish the book. They won't take any action on it. And then they'll pay $2,000 or $3,000 to have somebody do it for them because people are lazy. That's totally fine. It's just the human condition.
Right.
We've always wanted to just teach people when your body hurts, this is what you do. This is why it hurts. What is pain? Why do you have it? How do you use your pain to navigate your way away from it? That's the model. And that's what we teach.
So how do people get a hold of you? What's the best way to do that?
Probably the best is email. So we'll drop my email here. It's Dr. Chad, DRCHAD at NRGphysio.co. I'll drop this in the chat for you here.
Okay. And there is you were talking about these videos that you have. Is this on a website that people people want to learn this stuff, or we're just waiting for the book first?
No, the book will come out. If people want the book, we can set up some type of pre-order. Honestly, that'd be helpful in getting the book completed, but it's already built inside of what's called NRG University. And this can be done it's like self-paced, just work your way through. We onboard people, we help them understand what they need to be doing, and then just kind of let them loose on their own to just say, here's what you need to do.
Okay.
Or it can be combined with, 3 to 6 months of coaching. So it's a little more virtually hands-on.
And the way to do that, you said something about NRG University. Is that a website? What is that?
It's built into our CRM. So you have to come through me to get it.
Okay.
I haven't quite got that into just a self-pay, launch it yourself platform yet,
Okay.
but it's a lot of info and it can be overwhelming. So I still like to onboard people, even if they're not going to do coaching,
Yeah.
just so I can just kind of give them a lay of the land, help them understand, hey, here's where you need to start. This is the flow you need to take. And then let's get back on one more time and I'll build your blueprint for you. So like, okay, week 1 and 2, you need to do these things. Week 3 and 4, you need to do these things. Week 5, you need to do this. So it's like coaching light. But that way I don't ever want people, coming in confused or overwhelmed, because it looks like a lot of information. But if you just know, hey, here's the pathway. It's simple all you gotta do is watch a video and follow along. So we just want to remove any barriers that people might have. And so I like to plug in with people and just help them understand, hey, look, this is how it's going to go. Here's what you need. I'll be a resource for you virtually. And then people want to upgrade into coaching, great.
So the best way to do virtual visit with you is to email you.
Yeah. So
Okay.
I've got my email in the chat here. I'll also put our phone number, because you can text that number and me or Marcy will see that.
Okay. Why don't you say the phone number too? Because then
It's 317-707-9966. We'll say it one more time, 317-707-9966. You can text that, call that, and me or Marcy will answer.
Mm-hmm.
And you can just let them know, hey, I wanted to connect with Chad because I heard him on a podcast, and that way we know where you're coming from. We'll set up a little referral code.
Just do the word explode if you want.
Explode. Yeah, I like that. So anybody who's listening, if you want to email, call, or text and say, hey, I got this on the podcast, just say explode. We'll know where you came from. And we definitely want to reward Bob for that. I'm not going to cut you out.
Well,
yeah.
There you go. Chad just laid it out there for you.
Yeah. Yeah. So, we like to give credit where credit's due. So if somebody comes to us from the show, we're definitely going to have a thank you for that. No doubt.
Well, a cup of coffee is all I need.
Hey, a little caffeine.
When's the book coming out? Do we know?
It's probably going to be mid 2025.
Great. Okay. That's not long.
Yeah,
everything takes twice as long as you think it's going to take. So
yeah, it's a pretty heavy lift. That the third part of the book is going to be layered with like text and teaching, but also images of mobilizations and movements and anatomy, kind of packed into the deal. So there's a lot of like photography and stuff that's involved. I wrote the first 2 parts of the book in a week. Just kind of flooded out of me from 10 years of rolling it around between the years. Now, like I've got all the info, I've got all the videos, I've got the pathways, but taking it and putting it in image format is just going to take some time. So,
well, if you want to come back on when the book's published, I'd love to have you back.
Hey, man, I really appreciate you having me on. Been a great time.
It's great talking to you, Chad. Have a fantastic day, and thanks for being a part of the show. I appreciate it.
Absolutely.
Much appreciation for you folks listening to The Exploding Human. The website is theexplodinghuman.com. There's a YouTube channel where you can listen. That is The Exploding Human with Bob Nickman. Once again, I want to thank Chad Nowlin for being on the program, and have a fantastic day.